All right, let's talk about something that so many of us have felt, that burning feeling in your gut. What is really going on? Today, we're digging into peptic ulcer disease, and we're going way beyond just the burn to figure out what's happening inside our bodies. Let's do this.
You know that feeling, right? That burn, the indigestion, that pain that just kind of hangs around your stomach after you eat. It's super common. But here's the thing. It's not just some random annoyance. It's actually your body trying to send you a message, a signal that something is off with the delicate lining of your digestive system. So what's it trying to say?
Well, that signal is often pointing straight to something called peptic ulcer disease, PUD for short. Now, I know that sounds kind of intense, but what does it really mean? Just think of it like this. It's basically a sore, a little break, in the lining of your gut. The pothole analogy is perfect. Imagine the smooth protective road inside your stomach suddenly has a painful pothole. That's an ulcer. And these things can pop up in your stomach, your small intestine, or even your esophagus.
Okay, so how do these potholes even show up in the first place? For a long time, everyone blames stress or spicy food, right? Well, turns out that's mostly a myth. Science tells us there are really two main culprits working behind the scenes. Let's pull back the curtain on them.
Okay, on one hand, you've got this tiny bug, a bacteria called Helicobacter pylori, or H. pylori. Now, this little guy is surprisingly common, and it can actually live in your stomach. And what does it do? It's a specialist at breaking down that protective mucus layer, leaving your stomach lining vulnerable. And on the other hand, we've got something you probably have at home right now, NSAIDs. Yeah, that's your aspirin, your ibuprofen. They're great for aches and pains, but if you use them a lot, they can really irritate the stomach lining and pave the way for an ulcer.
But here's the good news. You're not powerless here. Before you even think about reaching for medication, there's a whole bunch of stuff you can do. Your lifestyle is your first and maybe your best line of defense. And these are simple changes that can make a huge difference.
First up, let's talk food. The thing to remember is that some foods are troublemakers. They can either irritate an existing ulcer directly, or they can weaken the little muscle flap at the top of your stomach that's supposed to keep acid down. That's why cutting back on things like coffee, alcohol, chocolate, and super spicy foods is a good move. Oh, and high-fat meals? They make your stomach empty out slower, which just gives that acid more time to do its damage. And a couple of simple gravity-based tricks. Don't eat right before bed, and try to sit up for a while after meals. It really helps keep everything down where it belongs.
All right, beyond what you eat, a few simple habits can be total game changers. For instance, if you're overweight, even a little weight loss can take a ton of pressure off your abdomen. Same with your clothes. Ditch the super tight-fitting stuff. Let your stomach breathe. Nicotine's a big one, too. It messes with your body's ability to heal and can weaken that same muscle flap we talked about. And here's a pro tip that sounds simple but really works. Prop up the head of your bed a few inches. Gravity becomes your best friend, especially at night. Okay, so you're doing all the right things, but you're still feeling that burn and you need relief, like right now. What do? Well, that's when you call in the reinforcements. Let's talk about the go-to solution for fast relief, over-the-counter antacids.
So how do these things actually work? The chemical firefighter analogy is perfect. Antacids are basically weak bases, and they jump in and do one simple job. They fight the strong acid in your stomach. It's a simple chemical reaction that neutralizes the acid, turning it into plain old water and a salt. And what's cool is, by lowering the acid level, it also shuts down this enzyme called pepsin, which is the very thing that makes an ulcer so painful in the first place.
But here's something you might not know. Not all antacids are the same. The active ingredient, the base, really matters. If you grab a bottle and see aluminum hydroxide, just know that one can make you constipated. But if you see magnesium hydroxide, watch out, that one can have the exact opposite effect. That's why so many brands use a mix of both, something called maltodextrin, to try and find that perfect balance so you don't get, either of those side effects.
But wait, the story doesn't stop there. It's not just about neutralizing acid anymore. A lot of brands are adding extra stuff to their formulas to tackle other symptoms that come along for the ride. So let's be detectives and figure out what all those plus signs on the boxes actually mean.
Okay, let's break it down. You see a brand like Malox Plus? That plus usually means it has simethonium in it, and that's just there to break up annoying gas bubbles. Simple enough. Some other products add something called oxythazane, which is actually a local anesthetic to numb the pain. But then you have L-ginic acid, which is honestly pretty cool. It creates this foamy, protective raft that literally floats on top of everything in your stomach. It acts as a physical barrier to stop acid from splashing back up. Pretty clever, right?
So, when you boil it all down, antacids are a simple trade-off. The big pro, they work incredibly fast. You get that relief almost instantly. But the big con, it doesn't last very long. The effect wears off pretty quick, so you might find yourself reaching for them again and again to keep that burn away.
All right, let's wrap this up. What are the big things to remember? Number 1, peptic ulcer disease is just a sore, a pothole in your digestive lining. Number 2, the main causes are that H. pylori bacteria or using NSAIDs too often. Number 3, and this is the most important one, your lifestyle changes are your secret weapon, your first line of defense. And finally, number 4, antacids are great for fast relief, but it's temporary. And now you're a pro who knows how to read the label and find the extra ingredients that can help you most.
So that brings us to the end. We've talked about what causes that burn, how to fight back with your daily habits, and how to get quick relief. Which really leaves just one question, and this one's for you. Thinking about all this, what's one small step, just one thing, you can do today to take better care of your stomach? Something to think about.